than 6 months. It hangs on long after the injury has healed, and we may not know the cause of the chronic pain. Pain relief is often temporary and therefore can lead a patient to become anxious or depressed. But chronic pain is very real and it needs to be treated. Radiating pain moves from the site where it originates to another part of the body. For example, when someone is having a heart attack, they may feel the sensation of pain in their jaw, shoulder, or arm instead of the heart where the injury is occurring. Phantom pain occurs after an amputation. The patient may complain of pain in their toes even though the leg has been amputated. The pain is real and the patient should be treated for it. Not every patient who experiences pain will tell us about it unless we ask them directly. Sometimes it's their nonverbal behavior that we have to watch for so that we know that they may be in pain and need to have treatment for it. Different ways that people will communicate to us that they are in pain might be by grunting, groaning, calling out, facial expressions, holding an area or a body part in a very guarded fashion, tensing muscles as in stiff and rigid arms and legs. Their movement becomes limited or their activity decreased. They may become irritable, angry, and restless. The skin may be cold and sweaty. Chronic pain is often manifested in more subtle ways, such as apathy, depression, or a sense of hopelessness. The caregiver's responsibility is to report the complaints of pain or the observation of pain to the nurse or other appropriate person right away. Pain has to be treated after it's been reported to you. Delays can make it very difficult in controlling the pain. But what information do you need to share with the nurse? There are many things that you want to tell him or her. The location, where is the pain? The type of pain, how did the patient describe it to you? Was it sharp, dull, crushing, pinching, burning, throbbing? Those are just a few of the many words that people use to describe their pain. Always use the words that the patient did. What was the duration of the pain? How long did it last? What's the frequency? How often has it occurred? Also, notice the effect of pain on the activities of daily living. How did the person do while they were bathing or ambulating? Did the pain seem to affect their appetite? Direct observation, that is you observing the patient, is also very important. Are they holding a body part or maybe limping? Noting the side effects of the medication that may have been administered is also important information to share. If you notice that after a person has been medicated that they are very sleepy, difficult to arouse, or as you're taking their vital signs, their respirations have decreased, that is information that you will need to report right away. Also share if the patient told you that they are experiencing relief from the pain medication. Most healthcare facilities consider the evaluation of pain the fifth vital sign. As a result, a pain rating scale may be used. The scale is used for subjective communication. Caregivers should never form their own opinion of a person's complaint of pain. Different scales may be used for children and adults. Become familiar with the type or the types of pain rating scales that are used at your facility. A very common one is a 0 to 10 scale. The patient is asked to give a number to the level and to the intensity of their pain. 0 is no pain, 10 is very severe pain. As a caregiver, you will not be asked to assess the patient's pain, but you will be expected to communicate the patient's report of pain to the nurse. For example, if a patient tells you that she is experiencing the pain at the level of 7, you will understand what that means on the 0 to 10 scale and report it right away to the nurse. There are other measures that can be used in addition to medication to help with pain relief. Basic Caregiving measures can be used to make the person more comfortable. For example, always tell the person what you are going to do and how you will do it. Assist the patient to a comfortable position. Reposition as often as necessary to relieve pressure on surgical sites. Use pillows to support body parts. Even minor adjustments to a pillow that is supporting an injured arm or leg can make a big difference in pain relief. Use methods to distract the patient. Soft music, watching television, maybe playing a game of cards or some other board game with them. Make sure that the room is comfortable and that the temperature is appropriate and that the lighting is dark or dimmed. Offer them a back rub. Provide a cool, damp washcloth for the forehead or maybe directly over the part of the body where it hurts. Listen to the patient's concerns and provide emotional support where appropriate. Never ignore body language or behavior that might mean that the patient is in pain. Many infants, children, and nonverbal adults won't be able to tell you exactly how they feel and that they're having pain. You'll need to look for clues. Always suspect and report pain if the behavior changes. For example, an elderly impaired patient who is normally quiet becomes agitated and noisy. A patient who stops eating for no apparent reason. Someone who may be normally talkative and friendly begins to cry easily and withdraw. An infant or a child begins to cry for no reason. Always report your valuable observations to the nurse. Remember that the patient's self-report of pain, that is their words to you that they are having pain, is the most accurate indication that pain exists. Their words should be respected and believed. Just because a person doesn't complain of pain or act like we think they should act when they're in pain does not mean that no pain exists. Don't judge a patient who takes narcotic medication for pain relief. Sometimes health workers try to discourage patients from using drugs for the pain, but studies have shown that it is very rare for someone with severe pain to become addicted to narcotics. In conclusion, although you as the caregiver are not responsible for the pain management of patients, you have a very important role in helping patients get the relief that they need and attending to all of their comfort needs.